I noticed I am a pediatric cardiologist, and I always give an advice for the parents before they leave my office. And I tell them, make it sure that you turn off your phone or whatever at least 2 hours before you go to bed, so you allow your time to. And then the parents, they have this big smile on their face, and they say, see, he said it. I didn't say it. The doctor said it. It's like they are looking for support. It just gives you an impression how much these parents are struggling, and we are one of them.
All right, so I'm going to talk today about a topic that no doubt has been, really, raising in awareness, in concern, in interest, and in research as well. Although I'll talk a little bit more about it, there's a lot of opportunities to continue to learn more. And like I said before as well, I think this is an issue that we need to really be aware and pay attention and continue to learn, both, from being a provider, but also from being parents and caregivers, because I am at least experiencing this both on the provider side, but as a parent of 2 teenagers right now, they are totally immersed in social media. So I think it's fair to say that, we have to agree right now that youth and social media and the use of social media by young people is pretty universal. Here in the United States, about 95% of kids 13 to 17 are having some form of interface with social media. About a third report that's nearly constant. And although from many of the platforms, the minimum required age is 13, here in the US, we know that at least 40% of kids 8 to 12 are being exposed to social media. And that's scary. So, we also know this is data from 2021, is probably even more by now, the 8th and 10th graders spending at least 3.5 hours a day on social media, and we believe this number continues to grow. So I think it's just to say that there are growing concerns, and I think part of the concern is driven, one, by the awareness that there are knowledge gaps, right? We don't have enough research, and we don't have enough evidence. Particularly, we don't have enough evidence to say that it's safe, right? And in addition to that, there's emerging new data and research that actually suggests that it can actually be harmful. So that is feeding into our growing concern. At the same time, I think we also agree that it's not all good or all bad or black and white. There's also, I think, an agreement that there are potential beneficial impact of social media in some kids, as well as harmful impact. So I think it's also helpful for us as providers and caregivers to think that this is not one size fits all, right? Kids will not interface, react, and be impacted by social media in the same way. There are several moderating factors that we believe might be, affecting that interface. This is just some of them. And I think just to remind us as pediatric providers that the developmental stage is very important. If we think about the developing brain and in the teenage years and up to early adulthood, this is the time, right, where risk-taking behaviors reach their peak, right? There's greater fluctuations of well-being, right? The moodiness, the irritability, the ups and downs that we can see in this age. But also it is the age that we know very typically a lot of mental health issues emerge, like depression. And there is some concern that, the developing brain in this stage might be especially susceptible to social pressures, peer opinions, and comparisons. And if we think about as exactly the input that they're getting social media, right? Some even say that social media use might be associated to structural changes in the brain, particularly in the amygdala area, leading to a higher sensitivity to social rewards and punishments. And then we get into that loop because that's what social media is promoting, right? That reactivity and rewarding and punishments. So it's a pretty interesting and concerning dilemma that we have right now. But there are other potential moderators, right? Like time matters, how much time they spend on social media, the content matters. And we're going to talk a little bit more about it. And certainly, understanding the different activities and interactions that the social media might promote, the degree of disruption of the activities. And it makes me think back, in the day when we asking, parents and kids in our offices, how much time you're spending playing video game, right? How much, night time and sleep time is the video game cutting? So I think right now we have to adjust to social media in addition, to video games, but how much disruption of daily activities is that, causing, as well as there are individual factors, right, that can also, in a way, play a role in how kids are, reacting to it, as well as cultural, historical, and socioeconomic factors that I will mention a little bit more. So not one size fits all. There are moderating factors that we have to take in consideration. Now, let's start with, there are potential benefits, right? So for example, think about potential positive community and connection with others who share identities, abilities, and interests. So this is particularly important for kids that might have a very limited positive offline socialization and might be able to mitigate and buffer that with positive interactions online. So that can be actually very protective and rewarding. We can also think about minoritized youth, and we see that a lot in the US, that, LGBT youth, racially minoritized youth that might be, ostracized, offline, or not have a more diverse opportunity to socialize, or not have an opportunity to socialize offline with people with similar interests and challenges. Online might promote that. You can create a space for them to validate and support each other, share interests, express themselves. And that can be very rewarding, right? It can be a buffer against stress and social isolation. So there are opportunities to have positive interactions with more diverse peer groups. But I think what we're going to understand as we go along is that in order for this to happen, to maximize the potential benefits, we need to put some guardrails around it. Well, but there's also the potential harm, and that's probably what's bringing us here today. And the conversation seems to be gravitating, understandably so, more on the potential harm the social media, seems to be causing or might be causing, right? We all understand now the significant impact of cyberbullying, right? Cyberbullying related depression and cyberbullying related potential suicide, right? That might be happening. And I think the social media and the online has really magnified the impact and the reach of bullying that we, in a way that we have never seen before. We also see it is a big problem, here in the US, body image and disorder eating behaviors. And we have understood that there are algorithms in some of the social media platforms that brings up this, content for kids that might be vulnerable and feed into this unhealthy behaviors, right? Poor sleep quality, kids that can spend, many hours at night on social media, unable to disconnect. And then you have, sleep deprivation and all the health and mental health impact of sleep alone. We also know some of the early associations between the use of social media, depression and anxiety. I mentioned suicide, as well as, there is a high relative concern of harm, at least here in the US, around kids that are already, inherently vulnerable. Kids already with some baseline vulnerability from the mental health point of view, as well as, adolescent girls. So just to give you an example, right, there are quite a few emerging research and studies, but not enough and not large enough and not systematized or randomized enough. But just to give you a sense of how we're looking at this. So the first bullet is with a longitudinal cohort study of over 6,000 adolescents here in the US that are adjusted for baseline mental health status, and look for these kids who spend 3 hours, maybe more, but around 3 hours a day on social media. What they saw is that those kids had almost double the risk of experiencing, worse or poor mental health outcomes, including some symptoms of depression and anxiety. So there was this association between 3 hours or more of social media and poor mental health outcomes compared to, the group. So on the other side is the inverse correlation. When they look at some studies, this is with, a college population, when they limited social media use to 30 minutes daily for 3 weeks, they actually saw improvements in the mental health status, right? So we started to see this picture where there's an association between use and amount of use and content involved and worse mental health outcomes. And when you limit the use of social media, you actually seem to have a better mental health outcome. So that is concerning. When we think about potential harm, again, I think we're trying to divide it up in 2 main categories. One is content, right? The other one is excessive or problematic use. So if we stay with content for now, I think it's helpful to understand as caregivers, particularly, as well as providers, that the social media platforms, they're not passive environments. They're actively pushing content, storing information, and there are design algorithms, that pushes content that can be quite harmful, confusing, stressful, to young people. So content matters. There has been, childhood death that have been linked to, suicide and self-harm related content and risk-taking challenges on social media platforms, right? And there's no filters. So there's a huge responsibilities for the tech companies that, we can't fix this alone. We're going to talk a little more about that later. But, but that is a significant problem. 65%, here in the US, in some of their research, 65% of adolescents say that they're either often or sometimes exposed to hate-based content on social media, at least monthly, 65%, right? And, 6 in 10 adolescent girls say that they have been contacted by a stranger that made them feel uncomfortable, at least once. Right. So we're talking now about, the predators. We're talking about cyberbullying, right? And the hate content that might be brought up. Think about being a minoritized group. It's significantly more vulnerable to hate content and cyberbullying. The other issue that I mentioned before that has really come up to surface here in the US is, the content around body dissatisfaction, disordered eating, social comparisons. They're really feeding to self-esteem. And it's been a big problem. I mean, to the point that, New York State Governor Hochul, launched a big mental health campaign, actually not too long ago, investing $1 billion in mental health. And there's a focus on youth mental health. And on youth mental health, they're focusing on social media. And on social media, they're focusing on adolescent girls and eating disorder because it's being recognized as a significant problem. Here, the social media, intentionally or not, seems to be feeding into that. And like I said before, I think, this is especially risky for kids and adolescents who are already experiencing mental health difficulties. So we have to put all these different pieces together. Now let's talk about the potential harm due to excessive or problematic use, right? We talked about how much disruption of other healthy behaviors is this causing, right? Sleep, nutrition, bathroom breaks, normal or in-person socialization, interactions with the family, right? So all these major disruptions that, excessive use of social media could potentially, cause. We also know that these platforms are designed to maximize engagement, right? And again, remember what we talked about, that in developing brain and this, was suggestion that the amygdala might become even more reactive during this age range. And then you have input and content that's just pulling you back and becomes very difficult to get out, to the point that some researchers believe that social media exposure can overstimulate the reward center in the brain And when that becomes excessive, it can trigger pathways very similar to addiction, right? And I think that makes sense in terms of the behavior, that we see even when particularly when we try to limit, the use of social media by kids that are being using significantly. And it's being linked to sleep problems, attention problems, feelings of exclusion in adolescents. And I don't know if you guys use this term FOMO over there, but FOMO here means fear of missing out. And it's a problem. I've seen in my practice, quite a few adolescents that report significant distress and apprehension and anxiety if they are, for whatever reason, unable to join social media, in the fear that everybody else is interacting and having social interaction, they're missing out something. So it's been nicknamed here, fear of missing out, and has been linked to significant distress, depression, and anxiety here. And I've seen quite a few kids that have described this to me, how distressing this can be. And that can affect our ability as parents in a way to try to limit. For example, we can talk about, about that a little bit later. But let's say if you say, listen, in my house, we're going to agree that after 11 p.m., no electronics, no social media, but all the other friends from the peer group are socializing social media until 1 a.m. So that person is going to have the FOMO, a fear of missing out, and they get very distraught that they cannot join like everybody else. So it becomes very difficult to contain, and put a behavioral plan when that happens. Now, a lot of research is still needed, right? I think we reacting, the concern is reacting to preliminary data. I think the challenge is that we don't have the luxury, at least we shouldn't, right? Wait years to have systematized research to act. If we have enough or emerging information and in observations that raises enough concern, we have to be able to try to put some guardrails now, right? So while more research is needed, we can't wait, right? Years until we know the full extent of the impact. And I think we also know, right, wearing different hats, that the burden of protecting the kids has fallen mostly on them, right, themselves and their families. So what's our role as a provider? And I think, a critical role right now is really, I think, is trying to provide as much as we can, the children, the family, with information and tools. And in order to do that, first, I think we need to be familiarized with the environment, right? There's such a thing as digital literacy. It's all the time. I don't fully understand, social media and all the interfaces and interactions, because that's not how I grew up. This is all new to me. So my ability to relate to that and understand is very different than my own kids. And I have to rely on them to kind of educate me. So we need to have enough digital literacy to be able to speak with the teenagers and adolescents about it and ask the questions and create that space when they come to see us. And the knowledge I make is that, many of you as pediatricians, right? I mean, we got used in the past to ask about, if you're riding a bike, are we wearing a helmet, right? If you're starting to drive, are you wearing a seatbelt? And no drinking and driving. And we do have to ask about social media interaction now, right? I think it's part of our, medical examination to, in terms of saying that. So I think we have to ask the questions and try to understand it, because if we don't, we might be missing an opportunity to identify, right, some vulnerable kids that are being bullied, kids that are experiencing significant anxiety and poor mental health that might be moderated by social media. So ultimately what we want is really maximize the benefits and minimize the risk. And I think when we ask, we can also learn of the potential benefits. And parents sometimes feel this dilemma when they see kids that might not be doing so well socially, offline, and they have the opportunity to have an online socialization, but comes with some degree of risk. And again, how we can try to maximize benefits and minimize the risks. So what parents or caregivers could do, right? And again, there's a lot of things they can do. And each of those bullets, right, there's different, text. I'll give you the references where we can, you can find, more detailed information. But one is, again, one of the things is creating a family media plan. And that entails intentionality, right? You have to create the space, you have to engage a teenager, you have to talk about it and try to create, for example, again, agreeing on some boundaries of, when you're going to use or not use, like, you're not going to use social media past 11 p.m. or midnight, or we're not going to use social media, during meals, or you're going to turn it off 1 hour before going to bedtime. So you're trying to have them to agree and engage and come up with a plan together. If we don't do it, right, I think certainly there will be very little change or opportunity to change exposure and behaviors that might be somewhat harmful, for our kids. The other thing that, I have experienced, is certainly as a parent, is the notion that, we have also to try, it's important that we have to try to model responsible social media behavior. If I try to tell my kid, listen, you got to look me in the eye when I'm talking to you and not to your phone all the time. When my kid comes talking to me, I'm kind of, watching Instagram. I have absolutely no credibility, and I'm giving a lot of mixed messages. And I've been caught. One of my kids have called me on that. Listen, you're telling me not to do it, but here you are. You're talking to me, looking at your phone. So I think it's important that we have to try to model, right, social media behavior, so we have a better chance of engaging them. And again, I think a lot of, is teaching about technology, empowering them to use that responsibly at appropriate, age. I think reporting cyberbullying, it's very important. We have to report if we see it to the schools, to the local authorities. I think we have to, in a way, take our part to protect the kids and protect, the community. The last bullying in terms of work with all the parents, this is not easy, but I think it's the example that I said. Sometimes you have a group of kids, they're interacting every night, and it's hard when one parent or two try to set limits, but not the others, because then the others will continue to interact. And then you create that fear of missing out and becomes this chaos. So sometimes actually I've seen when parents actually get together and they agree on, so no social media in all the 5 households after 11 p.m. and becomes much, easier to contain, but logistically, right, it is not easy to do it. Sometimes the parents coalesce and you have enough relationship to work on those plans together. But, that sometimes, can certainly help. And I'll give you, another example in terms of, teaching the kids about being responsible online. And a couple of weeks ago, I have a 17-year-old that, communicates often with his peer group through social media. And we are talking, and he's telling me that someone that he knows from his school seems like did something inappropriate. And then he's telling me that, he was trying to find out from that kid, if that was true or not. It was completely inappropriate, right? And gave me the opportunity to say, you should not get involved in this. You should not write or ask about this, right? And explain the potential ramifications and consequences that in his mind was completely naive. I'm just going to try to, out of curiosity, is that true or not true? And then occurred to me, this is happening every day, right? And I just don't know, right? So there are so many different opportunities every day for kids to get in trouble unintentionally. And I think they don't have the same awareness that we have about intention and impact, right? They might have no intentional awareness that what they might say or do in social media can have a significant impact. And I think, in a way, the burden falls on us as caregivers and providers to continue to bring that to the awareness. Well, there's also, right, some things that the kids can do, because again, we might give them, right, instructions about, and give them driver's ed and instructions and guidance of how to drive safely, but then they're going to be the ones driving. We're not going to be there with them all the time, right? So, it's how do we create again, an environment, a space where we encourage and empower them to reach out for help, right? To create boundaries to help balance online and offline activities, to develop protective strategies and healthy practices. We have to model a lot of those, right? And again, I think the example about my kid, be cautious about what you share, what you put out in social media. They don't have the same notion of boundaries as we do, right? And certainly we have to help them protect themselves. We do know that environment, there are predators, there are, algorithms to kind of, bring you into a darker place. So we have, is the best we can do right now is continue to educate ourselves, create the spaces and provide, the education. Now, we can't do this alone, right? I mean, I don't mean to give the message that is all on the providers, the parents and the kids, right? There's a lot that policymakers can and should do, and that a lot of what the tech companies should and need to do, like sharing data, help with the research, putting filters and safeguards to protect the kids. So it really takes the entire community and society to try to put the guardrails. But we can control the policymakers, while we can control the tech companies. What can we control in our practice, as a caregiver in our households? I think that's probably what we need, to focus. So, before we get into, conversation, I want to share some resources. The first resource, and feel free to take pictures. I can send the slide to Dr. Soliman as well. But the first link, I find a very practical and helpful link for families and parents and kids. It's an interactive website, and you can get a lot of what I said in terms of just practical things, what you can do, how you do, you can actually get it. It's really catered for the public, for the families. The second and third bullets, I find probably the two more helpful resources for providers. One was published not too long ago, a few weeks ago, by the US Surgeon General. It was an advisory of social media and youth. If you Google, you can get it. The same way the American Psychological Association also has a health advisory on social media use in adolescents. And I found both very practical and very helpful as a guide. As providers, and as a caregiver, it was helpful for me to go over those. But the first one, I think, is particularly helpful to share with, patients and families. So let me, I'll stop there and see if you guys have comments, questions. I'd love to hear from you and learn from you as well.
I noticed I am a pediatric cardiologist, and I always give an advice for the parents before they leave my office. And I tell them, make it sure that you turn off your phone or whatever, at least 2 hours before you go to bed, so you allow your time to. And then the parents, they have this big smile on their face, and they say, see, he said it. I didn't say it, the doctor said it. It's like they are looking for support. It just gives you an impression how much these parents are struggling, and we are one of them. And my question to you, I'll start with myself first. How can we control social media in our house? Is, somebody said there is this software, somebody that said this software, in addition to talking to your children. But I think the power on all of us, including us ourselves, to stay connected with the social media is so much. How can we better control? I close it. Instead of talking to them, they will have no social media anyway.
Yes, no, I think this is the $1 million question, right? And I don't think anyone has the right answer. I certainly don't have the right answer. Well, my reaction is that I don't think it's realistic to try to control. I don't think we can really control fully. It's out of our hands or control right now. I do think we can try to minimize risks, right? And again, I think the process that I think about is that, the old conversations that we used to have or continue to have about drug use, about drunk driving, about unprotected sex, right? And we have to create the space and normalize the conversations around safety on social media. That for me is still pretty foreign, you know, as a parent, right? So I'm trying to get a little more comfortable as a provider, creating the spaces to make that as a, you know, a routine part of my conversations and inquiring. You know, but there are a few things, right? I think one is, again, is starting the conversation, creating the space, and it's really depending of the age. For example, when my kids were first introduced and they said, I want to have an Instagram account, and they were like 14 years old as well. You can have an Instagram account at 14, but I have to follow you, right? So I have to see why you get it. Right. So those are, you know, those were some of the conditions, for example, that, you know, parents can do. Yes, if you want to have a social media platform, I need to be able to have some contact and oversight. Now, but to your point, I don't think we can fully control. We can't be with the kids 24/7. We can't control the feed, you know, from platforms. However, I think more and more there might be some, I would say, availability and development of filters, right, in terms of content that we can try to put, you know, some of the guardrails. But I think the first step is actually to talk about the kids. We have to start somewhere.
Okay, so there is a question from the audience here. Any relation from Dr. Khalaf? Any relation with autism, and is there any effect on the mobile phone, you know, waves on our children, on ourselves as well?
So,
is there any link of social media to autism, or much screen time?
If the actual waves might have some effect. Yeah. No, it's a great question. I've heard about that question. I haven't seen any data. That's kind of, you know, substantiate that as evidence-based. But I have heard the question whether, in addition to the interaction, if the waves itself might have some, you know, effect in the brain. But I think the other thing, going back to social media, is that, you know, thinking about a spectrum, right? And there's a lot of kids that might fall into the spectrum that are actively interacting social media, and you can make a case that, you know, kids with premorbid vulnerabilities can be more susceptible, right? Kids with mental health conditions, kids with already poor self-esteem, and potentially kids with developmental disorders, right? Their ability, one, to interface, understand, but also because they're more often targeted, right? In terms of being targets of cyberbullying and so on and so forth.
Okay, the question that I think I said it first, they are asking, is there any link between screen time and the high number of autistic children that we see nowadays?
I have not, again, I have not seen. I think the honest answer is we don't know, because we don't have enough data to prove or disprove. I think they are, you know, the only data that I've seen, and again, on that spectrum, is more related to ADHD. And, you know, both in that whether kids with ADHD are more susceptible to become really, you know, obsessed and hooked into social media in terms of their inability to shift the attention. But also there's some early studies that look at kids that did not have previously a diagnosis of ADHD, and a few years later, and correlating with the use of social media, seem to be showing, you know, some attentional issues. You know, there was a statistically significant. So there is this question mark whether actually social media use could promote, you know, the de novo appearance of ADHD-like brain reactivity.
Okay, thank you very much. There is a comment-like question here I see. It said, I wondered from the psychiatrist modality, in what ways can social media be used to promote the behavioral and the psychiatrist intervention and parent skills?
Yeah, if I understood the question well, I think that would fall into that bucket of potential beneficial effects, right? If we really use the platform to provide education, healthy content, and if in a way reinforcing healthy behaviors, it can be a very, very powerful tool. I think the challenges that we have is that we don't control those platforms that tech companies do, and it's a business, right? So I think that's when, but hopefully society, policymakers, we can coalesce. But I think this is a great, great critical point, is really turning something that right now is concerning, potentially harmful, to actually helpful.
You mentioned from your talk that you said the government in New York have decided to invest billions in mental health. Can you tell me what kind of programs that you have in Columbia University and NYB modality to help these children with mental health? What are you doing exactly with this $1 billion, which we don't?
Yeah. So Governor Hochul, that replaced Andrew Cuomo, she has a great interest in mental health, and then launched about a month ago her marquee mental health program at the state of New York, allocated $1 billion. Now, this $1 billion is going to be sliced and diced in many different ways, but a lot of it is going to go to supportive housing, in terms of addressing homeless and supportive housing and specialized services. And then, a lot of youth, mental health services as well. Now, Columbia already has pretty large and existent mental health network. So specifically for youth, we have, from community-based programs, we have, for example, we have providers that are embedded into primary care clinics. So they work very closely with primary care and pediatricians. We have clinicians that are embedded in 15 public elementary schools. So we see the kids at the school. So the therapists are at the school, and the psychiatrists do video telehealth for the medication management. And we have 3 psychiatrists that cover the 15 schools. We have a special needs clinic for youth, which basically treats kids with chronic medical and then psychiatric conditions. In the past, with kids with HIV, if HIV became a chronic condition, we see a lot of kids with GI problems and neurological conditions. We see transplant kids, as well. And then we have specialized services, like we have a dialectical behavioral therapy intensive outpatient program that we treat high-risk adolescents with high risk for suicidality, self-injurious behaviors. We have a cognitive behavioral therapy clinic that focuses on anxiety and depression management using cognitive behavioral therapy. And then, of course, we have the hospital-based services, emergency rooms, and the consultation services. So it's kind of a mix and match of community-based and then, more specialized services.
I see here some question about the government. Of course, I think I can make some comment. I'm not really involved in the government decision in UAE, but I will say what I know, that the mental health have taken a very good step forward in UAE, and the government start pushing. One of the struggle that we have in mental health overall, not just on the media, is the funding or the coverage. So the UAE government has been pushing insurance company to cover, and in Abu Dhabi specifically right now, there is most of the many patients has been covered by system like FIQA, and recently they start applying this services inside the school where the therapists go to the school. So the psychiatrist or the psychologist, speech therapist, activation therapist can go inside the school, and that's already system in Abu Dhabi. I am not very much aware in Dubai how it is, but I know it's selected by school what kind of service they can have, what kind of service they cannot have. As for the social media, I believe, it's still a struggle for us, and I'm not aware of the government controlling any special timing or special age against entering the social media or not. I really need to know about that. Okay, there is a question here, nice. How we can, with children, social media affect their talk and sharing in school? I think what they mean is the social media affecting their talk and their sharing in school.
Right. Yeah, no, I do think this is a community effort. And there's, if I understood the question well, I think there's different scenarios. One is, often we see cyberbullying, right, from students from the same school. And I think the parents should be encouraged, and the kids should be encouraged to tell the parents, and the parents should be encouraged to bring that back to school. And there's also kind of, the flip side, right, where we can use social media, and healthy behavior with social media and disseminate that through school and use the school as a platform. It goes back to having mental health in school. We need to bring the information, the resources where the kids are, and normalize that. And the schools promote a significant platform for that. And I think, to your prior comment, Dr. Suleiman, in terms of the progress, and some of the developments of the mental health resources for kids, adolescents over there, I give you a lot of credit in your team, because I know you've been advocating for that, for a long time. So, congratulations.
Thank you. Thank you very much. I have another question here. How can we control outcome of student ability to create and imagine things that are not real, and stop them from making false stories? I don't know how we can really, how can we stop them? How can, they see it everywhere, so they will make stories. Some of them will be right, some of them will be wrong. I don't know if that's there is any way to control. What do you think?
Yeah, so the question is how we can stop fabricated content to get to the kids.
Yes.
Yeah, no, we can. That's at the, one of the main issues for us right now is the unhealthy and potentially harmful content that is being pushed, all the fake news. And, actually, the research has learned that there are algorithms that actually promote racism, that actually you bring that to surface, right, very quickly. And kids are exposed now to hate content, right, even if that's not part of the cultural norm. So to your point, I don't think we can fully control. As long as they having exposure to social media, I don't think we can control, but we can try to at least minimize the risks, right, in putting as many guardrails as we can possibly be, using filters, using education and digital literacy, creating the spaces at home, working with the schools and work with other parents, right? So not easy. I'm not saying this is easy to do, right? But I think it's the best attempt that we have right now while more research and knowledge is developed.
All right, question from Dr. Agata. That's one of my good friends. I think everybody is my good friend anyway. But what she's saying, when should we start talking about screen time for parents and children? Should we start from the infant time and tell them what's the risk, what's the benefit, what's the all of this? Should it be part of our screening during regular pediatrician visit?
I think so, because I think we see so many toddlers already that the pacifier is the iPad, right, is the screen time, right? And again, I'm not blaming the parents, because I've done it. Sometimes it's much easier. You need to do something. You just give an electronic, see your video here, right? And then when we try to take it away, it's challenging. So I do think it's a very good point. As we continue to learn information about not only about the content, but we also learn information that perhaps, time matters, and what might be those thresholds that we can inform the parents, right, in terms of, limiting exposure. But I think it has to start early, because kids are being exposed, to electronics and screens very, very, very early.
All right, I have, some question, I modify them as I understood them. But the question here is, what do you think about the artificial intelligence? What's the effect of this artificial intelligence on our social media issues where everybody can make a lot of things without even doing any effort?
I know this has become a big topic here at Columbia. There's a whole task force looking to, AI in all sides. And I think, you can make an argument in either way, depending on, which side you are, whether this can be actually transforming the world for the better, or whether this can be actually, cataclysmic, the way some people say the AI can actually, have significant harmful effects. It's already going. There's a lot of AI built into these algorithms, in social media, and they continue to be developed. So I think it's a great point that it is built into the reality. But I think the jury is still out. I don't think anyone really knows what's going to be the end point. It is, for me, at least personally, is both. I have mixed feelings about the new frontiers and potential the AI can produce in terms of, in medicine, in healthcare, in education, as well. But also there is this other concerns that, have been raised. So I think we all kind of, looking at, how this is going to evolve.
Thank you very much. I think this will be my last question to you, as I think it's been almost 9 p.m. in our time. The question here, isn't using the social media affecting the child's skills in communication? Does it affect his ability to communicate?
Yeah. No, it is a great point. And I think we are seeing more and more that the way kids socialize online, of course, is very different than when you socialize offline. And it's helpful to think that is not either or, right? That is still the belief is that we need to continue to promote and encourage offline social interactions. What we're seeing is that the more exposure to online interactions and the least exposure to offline, kids become more socially inadequate, more socially anxious. They don't know how to manage. They don't know how to read. Because if we think about it, it's a learning process. We're learning how to socialize and respond to visual cues and social nuances, right? Since we're little kids, and we grow in that, and socialization, right, is arguably the main developmental milestone or task in adolescence. And if now we're really restricting, offline socialization because social media is taking over, all those milestones and social skills, in a way, they're slowed down, or we're getting to a halt, right? So I think, I wouldn't say much in terms of, the language or the verbal communication, but certainly the social communication and ability to interact. I do believe it can be moderated and significantly impacted by social media.
Thank you very much, and really appreciate your help, Dr. Batista. And there is a last question that just asking if they can share the presentation. The answer is yes, you can share it with your kids, with your friends, with social media, if Dr. Batista will allow, and I'm asking him directly. Is that okay to share your presentation?
Yeah, of course, absolutely.
The last comment, I'm sorry, I wasn't gonna ask you anymore, but the last comment asking, is there such thing that addiction, and is there a treatment?
Right. Yeah, no, it's a great point, because I think some of the research is saying that both the behavior as well as the potential structural changes in the brain seem very similar to what we see in patients and adults with addiction, right? So there is the FOMO, right? The fear of missing out, that it's almost like psychological withdrawal, right? And the apprehension and the distress, the agitation. So yes, I do think is a very pertinent question, that there's a lot of the behaviors and actually the interventions are very similar to addiction. So we try to use some of those behavioral models to apply in terms of, moderating and limiting, online and social media exposure.
Okay, thank you very much, and really appreciate all the talk and appreciate all the audience. And I just want to tell that we have decided to switch to 8 p.m. for all our lectures. At the vote here is 52 against 22, 9 a.m. 22% or 29%. And at 8 p.m. it's 71%. So I think we'll switch to 8 p.m. for all our conferences. Thank you very much, Dr. Batista. And
Thank you. Thank you for having me. Good night.
Thank you.